fed up with varicose veins? You are not alone. Millions of Americans, about 25 to 40 million people, in fact, deal with the painful condition, and now there is a procedure that can give you relief fast. And doctor, you are Dr.
Raffi Krikorian.
Raffi Krikorian, thank you for joining us.
Thank you for having me.
So this is a brand new procedure for varicose veins?
It's been around for 2-3 years, especially the form of the catheter closure fast.
Okay, but it hasn't been in St. Louis before. Just
Probably,
new to
yes,
St. Louis?
yes.
So what is it? It's the catheter that does what?
This is a catheter that gets into the area of the vein that has a leaky valves and try to eliminate the source for the varicose veins by hitting the wall of the vein, and then create a scarring procedure that lasts up to, can take place for 3 weeks and closes permanently the vein.
Really? And it works that fast? You can do it on like in your lunch hour for real?
Well, that's most of the time. It's in a good candidates, really, within an hour, patients on their feet and go home after the procedure.
So are you talking about the bulging varicose veins like the ones that we're looking at here that can tend to really hurt too, right? First, what causes the varicose veins?
A lot of time varicose veins, especially in the legs, the area that we treat the most, are due to problem with the so-called superficial veins having leaky valves, which direct the flow toward the heart. But if the valves are leaky, the blood stagnates, it goes into the branches and causes them to enlarge, become non-bulgy.
Okay.
I mean, non-compressible, bulgy veins.
Okay, so now this procedure, how does it differ from things in the past?
It essentially addresses the area of diseased valve, very non-invasively, with less pain and swelling, and has very good long track record, 95% plus success long term.
Wow. Does it leave marks or scars on your leg?
Just a puncture site. It's similar to catheterization, but you get into a localized area, mostly around the knee, just a puncture site. No scarring, no cutting, not like the venous stripping, which definitely is much more painful.
It was pretty crude back in the day when they used to just strip the vein, nothing like that,
that's right? Plus, it's not working very well, that procedure, long term.
Right, okay. And does it hurt, the procedure?
For most part, I don't use any narcotics, just Tylenol or Aleve enough overnight.
Really?
Yes.
Okay, and are there some veins that you can't use this with?
That's one of the things that's in our armamentarium of treating veins. This is the mainstay, but some patients require probably injections or small procedures taking out the bulgy veins, but this is the mainstay of our therapy.
Okay, and so this really goes into the vein. It doesn't do things with the spider veins that you have, the superficial ones?
Yes, you need to be injected.
Okay.
But if you have underlying vein disease, the spider veins could be a sign of underlying disease which can eliminate, and some of the spider veins can get smaller, disappear if you treat the underlying bigger problem, which could be treated with a catheter again.
Oh, but not always a bigger problem, because isn't it kind of normal for a certain age to be getting those? Okay, and finally, what does it mean when someone's vein collapses?
That's layman terminology, which I think we sometimes try to understand the situation. Could be essentially collapse due to arterial blockage, if they meant artery blockage.
Really?
So it's kind of hard to be sure what the...
So if somebody has a vein that collapses, you say check out your cardiologist?
I think for the most part, vein disease is treated by a variety of experts, not only cardiologists, it's the minority vascular surgeons, and now there's a specialty called phlebology, actually.
Oh yeah, phlebitis, like Richard Nixon had phlebitis.
Yeah, it's just a specialty that's evolving. It's very exciting. We're very enthusiastic about it because of a huge amount of people that need it.
Okay, well thank you so much, especially women, but men have it too.
Yeah, 1 in 5.
All right, so if you would like to learn more about the procedure and how to get the treatment, you can go to kpr11.com and click on the noon page. We'll be right back.